today's update on COVID-19 here in BC. We have 29 new cases who have tested positive in British Columbia today, for a total of 1,203 people who have tested positive for the disease in our province. That includes 554 people in Vancouver Coastal Health, 424 in the Fraser Health Region, 76 on Vancouver Island Health Region, 128 people in Interior Health, and 21 people in the Northern Health Region. In addition, we've got one more long-term care facility outbreak in the Fraser Health Region, which leaves us with 23 outbreaks now in long-term care. As I've mentioned, this is an area of particular focus that we have been working on, particularly the long-term care homes in the Lower Mainland, where we know we've had two very serious outbreaks that continue. And it has been, most of the rest of them we've been able to manage with just a single case being detected, and a full outbreak response has taken place. So for most of these outbreaks, catching it early has made a huge difference in protecting the people in that facility. We have 149 people who are hospitalized with COVID-19 in BC today, including 68 people who are in ICU or critical care units. We have an additional 3 deaths to report today as well, and as always, we recognize that this number represents people who are dear to their family, to their friends, and who will be missed, and our condolences go out to them. We now have 704 people, though, who are fully recovered from COVID-19, which is also a very positive thing. Today I wanted to talk a little bit and give you an idea about some of the important research efforts that are going on to help support both our response now on the ground here for COVID-19 and to ensure that we have the best possible information that contributes to the worldwide understanding about this disease and how it can be treated, how it can be managed, and our connections to important research that's being done around the world. So we have established a COVID-19 Strategic Research Advisory Committee that is being led. The initiatives have been led from very early on by Dr. David Patrick, who's one of our colleagues and a physician epidemiologist who works at the BC Centre for Disease Control and at UBC. And he has been the lead in developing our research and innovation program from early January when we put our response team together. And he's got a group of scientists and researchers and medical professionals from around the province who are working on this, and I'm very grateful for all of the work that they put into this. And on our research advisory committee as well are a number of public health experts, including my predecessor, Dr. Perry Kendall, who we've brought back in to provide advice at this critical time. So this advisory committee is going to facilitate the ongoing research here in BC that will contribute to our understanding and knowledge, also contribute to the information that we get on a daily basis to help us understand how we're doing. So things like the modeling that we've presented here. We've also allocated at least $2 million in funding to the Michael Smith Foundation for Health Research, and the foundation has been working from early January with the BC CDC on 4 specific things that we've been tracking already. One of those is tracking transmission of the virus in British Columbia, and that is contributing to the modeling that we've presented, as well as the more dynamic modeling, a more detailed model that we'll be talking about in the coming weeks. We've have a research project that is underway to understand the baseline susceptibility of people in British Columbia to COVID-19, and that will allow us, as I've talked about before, when we have a serologic test that helps us understand who has been infected and who's immune to this disease. So we needed to put the building blocks in place prior to the virus coming to BC to be able to do that in a systematic way. And some of the researchers at BC CDC, particularly Dr. Danuta Skowronski and Dr. Mel Krajden, have been working on this for some time with the support of the Michael Smith Foundation. We're also being supported an initiative to develop a vaccine for COVID-19, and there are at least 25 vaccine initiatives around the world, and we are part of that through Dr. Srinmurthy and his team, and the funding that we've got through Michael Smith. And one of the other really interesting things that we're working on is understanding how the infodemic, it's being called by many people, but the myriad of information that is out there on social media, on other platforms, and how that impacts people's behaviors through this pandemic. And that's one of the other key things that we're working on. The first research call that the Michael Smith Foundation is doing, it is aligned as well with a number of research initiatives that have been underway from the Canadian Institute for Health Research, our health authorities, the Public Health Agency of Canada, and many more partnerships. The first call we're looking at are things like the rapid evaluation of the public health countermeasures. How well are we doing with the things that we have put in place, like travel restrictions, like the cancelling of in-classroom schools, in-classroom teaching in schools, like the distancing measures that we have been putting in place across society, and understanding which of these measures works in which scenarios and how well they work. We also have a lot of BC-specific population epidemiologic information that helps us determine how we're doing in our case and contact investigations, and how we're doing in specific populations around the province. So all of these are really ways to bring the brightest minds and researchers that we have across BC together, and to link them with our colleagues around the world and across the country. And I just want to say this is really an important part of our toolkit to help us get through this first wave of COVID-19, and to help ensure that we know what to do and how we can do it as this pandemic progresses, and whether we have second waves and everything that we can do between now and having treatment and having a vaccine for this virus. So I want to thank everybody that's been involved in these research projects, and the ones to come, and the Michael Smith Foundation in particular. I know we are working with all of the universities across British Columbia, and I think this is going to be an important part of helping us get through this and know what to do for the future. Finally, I just want to reiterate what I talked about yesterday, that the risk remains very high for us right now in British Columbia. We are in the thick of it, and we must hold our line. This is our time to be unwavering in our commitment to keep our firewall strong, to keep our distance between us, our physical distance, that safe distance between us that doesn't allow this virus to spread, but also to ensure that we're taking those measures to keep socially connected, to support each other in our families, in our communities, so that we can get through this together. And I know people have gone to extraordinary efforts and made many sacrifices, all of us, across this province, to protect our families, particularly to protect our elders and our seniors and our healthcare workers. And all of us must continue every day to do those important things that prevent transmission of this virus. Things, the motherhood things that I talk about all the time, washing our hands regularly, staying home as much as possible right now, if we can, staying apart with our physical distancing while staying connected. And particularly, we want to talk about the importance of self-isolating, staying away from others if you are sick, or if you are a traveler, because we know that there are risks in people who coming back into this country who have traveled. And travelers, as we know, there's a federal quarantine order now that you must immediately self-isolate for 14 days from the moment you arrive here in British Columbia, whether it's at the airport or a land border, and without question and without exception. And we, as a community, will support you in doing that. So if you have a loved one, a community member who's coming home, do what you need to do to support them. And that may mean buying groceries for them and dropping them off, making sure that they have a way to get home from the airport without having to take public transit. Having frequent virtual visits. We need as a community to support people to do this. Sharing books and videos. You know, we need to be united, all of us, in stopping the transmission of this virus now. So join us. If you have family or friends who are coming back, we've all made this sacrifice in BC, and it is helping us. It is helping us keep this manageable so that everybody who needs the care that they in our healthcare system gets what they need. This is our time where we need to keep our firewall strong. We all can stand proud knowing that we're doing our bit and that we are holding the line for our families and our communities here in BC.